Welcome to County Portal, your simple source for local government services and public records. Let's get started.
How much can you make and still qualify for Medicaid? That's a critical question for millions, but the answer isn't a single number. It almost entirely depends on where you live. Medicaid is a health insurance program for low-income Americans, run as a partnership between the federal government and each state, which means the rules change from one state border to the next. To understand these rules, you first need to know about the federal poverty level, or FPL. This is a number set by the government each year that represents the minimum income a family needs for essentials. Medicaid eligibility is almost always calculated as a percentage of this number. The biggest difference between states is whether they expanded Medicaid under the Affordable Care Act. In states that chose to expand, the rules are much more straightforward for most adults under 65. You can typically qualify if your household income is at or below 138% of the federal poverty level. To give you an idea, for 2024, that's an income of about $20,783 a year for a single person or around $35,632 for a family of 3. In these states, it's primarily about your income. However, in the states that did not expand Medicaid, the rules are much stricter. The income limits are significantly lower, often far below the poverty level itself. More importantly, having a low income alone is usually not enough to qualify. You must also fit into a specific category, such as being pregnant, a parent with a very low income and dependent children, elderly, or having a qualifying disability. The specific income thresholds and categories in these non-expansion states vary dramatically, so checking your state's specific requirements is essential. It's also important to know that certain groups, like pregnant women and children, often have higher income limits, even in non-expansion states. When Medicaid determines your income, they use a figure called Modified Adjusted Gross Income, or MAGI. This isn't just your take-home pay, it's your total gross income from sources like wages, tips, and unemployment, minus a few specific deductions. The best way to find the exact numbers for your situation is to go directly to the source. Visit your state's official Medicaid agency website or go to healthcare.gov. You can fill out an application there, and the system will determine if you likely qualify for Medicaid or other health insurance options based on your specific details. Thank you so much for watching. We hope this breakdown helped clarify how Medicaid income limits work. It's a complex system, but knowing the basics can empower you to find the resources you need. If you found this information helpful, please give this video a thumbs up and subscribe to our channel for more simple explanations on important topics like this.